You speak from heaven, we call it thunder. You are amazing. You smile from heaven, we call it rainbow. You are amazing. And you look from heaven, we call it sunshine. That's amazing. And you made me in your likeness, super amazing. You are amazing, God.
Good afternoon, everyone. I just stand on the existing protocol, but I want to recognize Reverend Akiyemi because I used to stay near your church, and I want to thank you for the good job you did to tar that street, because God used you and your church to make that place more motorable. Yeah, well done, sir. So I also greet my colleagues who have done splendid job. Okay, let me just start up. So the kidneys, if you make a fist like this, all right, that's like the size of each of your kidneys, all right, and they are located just about the back side of your rib cage, and they, of course, they do lots of work. Somebody says when the kidneys fail, almost every organ is involved, all right, and the thing that, next slide, what makes the kidneys work is what we call the nephrons, all right, and you see a structure of the kidneys that is displayed there, and the nephron is essentially very tiny. Each of your kidneys has about 1 million of them, and it's responsible for filtering out your blood that will eventually form urine. So if you look at it, 180 liters of fluid goes through your kidneys every day, but your kidneys are so designed by God that out of that 180 liters, just about 2 liters comes out as urine. So that shows the complexity of what God has done to give us 2 kidneys. I'll come to the aspect that he was talking about, the town. So it's quite a structure that is looks simple, but there are a lot of things going on in it. So up to about 25% of what the blood pumps out goes through the kidneys. And what do? They regulate body water, all right? So no matter how much water people drink, which we're encouraged to drink, all right? But I will put a proviso there that in as much as you want to drink water, let's know what the functional capacity of our kidneys are. I saw a WhatsApp message a few months ago where somebody was saying, oh, people should just be drinking water, until one woman drank and then she became unconscious. Because if you drink too much and your kidneys can't handle it, then it can cause edema in the brain or swelling of the brain, and that can present as an emergency. So they regulate body water also, mainly, and they regulate other chemicals like sodium, potassium. They regulate your blood pH, all right? So acidity, alkalinity of your blood is regulated by your kidneys. And they excrete many waste products. The ones we're able to measure are usually the urea and creatinine. We talked about creatinine being very high if somebody has kidney failure, but we don't want it to get to that level before people come. That's why the essence of early screening is very important. And that concept that Prof. Ruda mentioned, screening to detect early. All right, I'll come to that soon. Now, they also elaborate some hormones like erythropoietin, renin, calcitriol. Okay, so next slide. Right, so we'll talk about kinds of kidney failure. There's an acute kidney failure or acute kidney injury, in which the capacity of the kidneys to work reduces within a few days or within a few weeks, all right? And this can be a problem even in people who are admitted into the hospital. I'm sure many of us have heard of cholera epidemics, right? So many people who die in cholera epidemics is because the water in their body is depleted from vomiting and stooling. And because of that, the kidneys should shut down. So many of those people will have acute kidney injury, which if they get treatment on time, they get IV fluid, they are able to resuscitate and they're able to live. All right? So what are the causes? Next slide. If somebody is vomiting, women that have childbirth and they lose lots of blood, people that use agbo, yeah, people that have crush injury from collapsed buildings or road traffic accident or burns, all right? And then severe infections like malaria, all right, using pain tablets like ibuprofen. So there are quite a number of things that people need to know that can cause acute kidney injury. The important thing is that once they present early, we're able to start treatment, and they may need dialysis, they may not need dialysis, depending on how early they present. All right, now next slide, the one I want to talk about that will form bulk of presentation is chronic kidney disease, which tends to occur when there is progressive and irreversible damage to the two kidneys. Okay, this lasts over 3 months, and usually the functional capacity of the kidneys will reduce below 60 mils per minute. So, chronic kidney disease, or CKD, as we call it for short, is a global health issue. All right, its prevalence is increasing all over the world. In America, between 1973 and 2011, the number of people who had dialysis, okay, rose from 10,000 people when they started the program. So America funds dialysis for their patients, or for their citizens rather. It rose from 10,000 to about 615,000. So that's a progressive rise over a period of about 30 years. Now the cost for treating these people just in 2011 was about $50 billion. And then for each person doing dialysis in America, they spend about $90,000 per annum. Whereas if that person does a kidney transplant, he'll be spending about a third of that, about 32,000 USD. All right, now despite this huge sum, there continues to be increased morbidity and mortality and reduced quality of life. Okay, so chronic kidney disease is something that is a non-communicable disease. In America, 6 out of 10 people have some degree of chronic kidney disease. In the UK, it's about 1 in 5 men and 1 in 4 women. In Nigeria, we have done screening in different parts of the country, and we've come up with a figure of between 19 to 30%. So we have classification that if you Google it, you'll see that classification there. So I would say that about most people will have close to 100% function of their kidneys, and is measured by what we call glomerular filtration rate. We use a calculator, we feed in the serum creatinine, and when we become a bit alarmed is when that calculation gives us less than 60 mils per minute. What are the things we do to screen for chronic kidney disease? So urine analysis, just to check the urine, is very important. Many times people talk about malaria and typhoid. They've treated malaria, they've treated typhoid, and the person is not getting better. But if they just check the urine, it may be that the person has some form of kidney disease. So we do serum electrolytes, we do the urea and creatinine, we do the blood glucose, we do serum cholesterol, we do the blood count, we do an ultrasound, and then we check blood pressure like Prof mentioned, and then sometimes we do what's called a kidney biopsy. All right, so what are the symptoms for people who have chronic kidney disease? The interesting thing is that no symptoms, like Prof mentioned. So high blood pressure, we call it silent killer. Diabetes, we also call it some kind of silent killer. Chronic kidney disease is also a silent killer because in the early form, no symptom. All right, so sometimes people can have foamy urine. Okay, just keep moving the slides to get to symptoms of chronic kidney disease. Okay, sometimes people could have foamy urine, they could have blood in their urine, They could have be waking up overnight to urinate. They could have leg swellings. When it's advanced, you see them throwing up, poor appetite, get tired easily, poor sleep. Go on, go on, go on, go on, go on, go on, go on. All right, so these are the risk factors and the things that cause chronic kidney disease. You see, number one, then hypertension, which Prof. Bankolo mentioned. All right, so that's number one cause of chronic kidney disease in Nigeria. In developed world, it's diabetes, but we're beginning to see a combination of both in our environment because many people are eating big time. Yeah, when I was in UI, 80s, early 90s, there was no Mr. Biggs. All right, but now we have several of them. I mean, those days we used to crave, let Mr. Biggs come to Ibadan so that we can also have some nice time, not knowing that those things are not really too healthy for us. All right, so hypertension is something that it affects close to 40% of our population. World Hypertension Day was celebrated just last Saturday. So there's a rule of 3. So 1/3 of people who have high blood pressure are not diagnosed. All right. Another 1/3 who are diagnosed are not controlled. Then 1/3 who are diagnosed, controlled are probably the ones that are taking their medications. And medication for hypertension is lifelong. All right, so when I tell that to patients, they don't like to hear it. I know we're people of faith, but I would like someone to open to me the book of Luke, chapter 5, and verse 31. Can someone open it and let's read and hear the golden words from our Lord and Master, Jesus Christ. Anybody there that can read it to us? Luke 5:31.
Galilee, and taught them on the Sabbath day. Luke 5.
31.
And Jesus answered and said to them, those who are well have no need of the doctor, but those who are sick.
Thank you, sir. All right, so Lord and Master said, those who are well have no need of physician. So what we're emphasizing is that when you are not well, you should pray. There's no danger, or nobody says you should not pray. Believe God and call for the elders to pray. Okay, and it's the prayer of faith that will heal the sick. Okay, but like my brother admitted, like I tell people, if you've not had faith to believe God to have a headache healed, don't go and start praying to believe God to have hypertension or cancer healed. There's level of faith that each person, the Bible says God has given to every one of us a measure of faith. Only our Lord and Master had all the faith, and only he had all the gifts that he could operate in. But every believer has a measure of what the Lord has given. Okay, so when there is a diagnosis, let's not just faith and faith and faith. And God forbid that we end up dying before our time. All right? So how do we treat? Next slide. Control elevated blood pressure, control diabetes, reduce salt intake, reduce excessive protein intake, reduce food that are rich in potassium, rich in phosphates, moderate your water consumption. So that's quite important. There might be a need to take calcium supplements, active vitamin D, erythropoietin injections. All right? Associated conditions with kidney failure, stroke, like Prof was talking about, myocardial infarction, heart failure, peripheral vascular disease, and several others. How do we treat? We can do conservative care. We can offer hemodialysis, which is available in many centers. Thankfully, the government is thinking about it now. They are doing some subsidy in some centers. And then when the person is young and can undergo it, we offer them kidney transplants. How do we prevent? Because that's actually where we should be talking. because we don't want you coming to our dialysis centers. We don't want you coming to our transplant centers. We want to prevent. Okay, so early screening. I always talk about giving yourself a birthday gift. So you can do a screening that, if you look at how much you spend on airtime, if you look at how much you spend on whatever you do, if you just give yourself a birthday gift once a year, all right? I started doing mine at about the age of 38. I'm a little above 50 now. Lagos State is already counting for me when I should retire. So I started doing mine at about the age of 38. So I do it every year. I just go in and have it screened. And so screening helps to detect early, like you mentioned. All right? Early detection. And if somebody is found to have high blood pressure, take your medication. I tell people, medications for blood pressure, you can take it first thing in the morning, whether you're fasting or you're not fasting. You can take your blood pressure, all right? Medications, all right? Then treat diabetes if it's diagnosed, and then early referral to specialists, because like my colleagues admitted, many people present late. By the time they are coming, they're already needing dialysis, all right? Avoid using herbal remedies, smoking, cessation, alcohol, stop. Use of toning cream. Women want to be like Oyibos. So let's not encourage that. Using medicated soaps are not healthy. Government should support, all right, which they are doing in the bit they can, but I'm not sure they are doing enough, because some less endowed countries like Sudan, they are doing dialysis for their citizens. A colleague told me that he went to Niger a few months ago, and he saw a big center that the government built, but I don't know how well. But the government is supporting them. I'm not saying that support here. What I'm saying is pockets of help here and there. Health insurance needs to come in to help. I've engaged them in one forum before, and they said, well, they can't get to that level now. But I'm hoping that someday we'll be able to have that conversation. So I will talk briefly about a study we are doing in Nigeria, which is supposed to help us detect people that have early stage of kidney disease and be able to offer some treatment. So it's a drug trial. There's a drug that's, okay, let me start by saying that there's a gene that is exclusive to Africans only, that was first developed in about a year, that was first discovered, not developed, discovered in the year 2010. All right, so it's called apolipoprotein 1 gene. You can Google it, APOL. So that gene was something that prevented Africans, all right, from developing sleeping sickness. It's similar to sickle cell, which is supposed to prevent from severe forms of malaria. But this APO1 gene is something that was detected about 2010. So in the US, the black people constitute just about 3% of the population. But among those doing dialysis, they constitute about 8 to 10%. And they were wondering, why is this high prevalence of kidney disease among African Americans? And by the time they did genetic study, they found out that this APO1 gene actually is responsible. All right? And because all those guys migrated from here many years ago. So we've come back to do studies in Lagos, in Ibadan, in UNTH, that's in the southeast, and found out that this gene is quite prevalent. Up to 80% of those on dialysis have this gene. Among people who don't even have kidney disease, it was found to be as high as 20% in the southwest and 30% in the southeast. So what are we doing now? We are looking at people who may be related to those that have on dialysis, or those who have high blood pressure, or those who have any form of kidney disease, and we start them on a medication. We make sure that they have this high-risk gene, all right, and then we start them on the medication and we monitor them. So it's all paid for by the drug company, and they are helping to stop and stem the tide of kidney disease among our people. So I coordinate the recruitment in Lassuth. Somebody is doing that in Louth, another person in Naima, another person in UNTH, another person in UCH Ibadan. So we're hoping that we can stem this tide. And you hear about precision medicine, that people can actually be told the best drug that they can use. This is the beginning of it. All right? In some years from now, we just need to know your genotype, APO1 genotype and tell you that this medication will reduce your progression to end-stage kidney disease so that you don't need to go into dialysis. You just take this medication and by God's grace, you'll be fine. So what do we do in terms of lifestyle modification? We want to reduce salt intake. We want to reduce those that are huge. Don't want to call them fat, but they can reduce their weight. Increase consumption of fruits and vegetables. Also increase your consumption of fiber. And then you avoid alcohol or just stop it completely. And then exercise. It's very important that we do exercise. I'm always impressed when I see patients who tell me that they are doing exercise and it's helping them to control their blood pressure, their diabetes. But we also want to say don't go jogging. Jogging may hurt your may hurt your joints after some years. So look at that. I think it's my penultimate slide. Okay. Next slide. Okay. So cost of screening, you may spend about 60,000 treating high blood pressure. Conservatively, it's less than 20,000 per month. But hey, if you spend that, but look at the cost of dialysis. Okay, 600,000 per month. And that's just for dialysis. It doesn't include some other things that needs to be done. All right, look at cost of transplants. The center where I work is 20 million. And how many of us can afford that? So in conclusion, chronic kidney disease is increasing in prevalence worldwide. And considering the economic implication, there's need to use concerted efforts on the part of the clients or patients, caregivers, and the government to ensure that this epidemic is nipped in the bud. Thank you very much, and God bless you.